In this video, we're going to go over another case of subdural hematoma. And again, one of the first things we're going to do when we're looking is we're going to adjust our window to make it more of a traditional subdural window. And already right off the bat, we can see that there are probably bilateral subdural collections, right greater than left, that clearly have some chronic component because they're almost CSF density. However, as you scroll through both on the axial and the coronal, you'll start to see, especially on the right side, that there is layering hyperdensity, which probably represents an acute bleed in the setting of having a chronic collection. So this could be like a hygroma that had had bleeding into it, or a chronic subdural hematoma that had an acute component of bleeding. And there probably is, you can see some hyperdensity scattered throughout the left side. It's not as impressive, but most likely there's bilateral, like this right here, areas of bleeding on both sides in these chronic collections, right greater than left. But the moral of the story is there is acute blood here, so you want to make sure that you notice it, especially here on the coronal. You can see how eye-catching that is when you know to look for it. So you want to make sure that you draw attention to this and you don't just write this off as being chronic collections. There is an acute component here. So this is acute subdural hematoma.